home as helping with care. We have feelings of guilt for asking for help or even cultural considerations. As well, many are not aware that they are caregivers and are just doing what they feel needs to be done. Parents who require care often do not have their parenting needs considered by the supports they are receiving, and their children are left out of our conversations. Some keep their situations a secret out of fear, stigma, or unwanted interventions, and it may be difficult to engage with families depending on those circumstances. The needs of the family may only be identified when there is a crisis, or we do not have the mandate to ask children in the home how they were doing. And many professionals lack the capacity to even engage with children and youth and do not know how to respond. It is these barriers that make identification of caregivers important if we are going to be able to support them. So why don't they get identified? Typically, the term caregiver or carer is associated with paid professionals in adult positions. With both of these terms also being highly westernized, it does not account for cultural impacts that includes form of caregiving provided by children and households. It is important to consider the terminology used, as not everyone associates or agrees with the terminologies and this aids in not identifying our caregivers. Fear and stigma are also the major reason why caregivers are not identified. This may be due to the fact that families who are aware of their situations may be reluctant to identify due to stigma and reactions from professionals. In many cases, it is unidentified deliberately to conceal these caregiving roles. As well, with these families, there is a significant level of children who become apprehended or families are investigated when they are seeking these supports. And generally, it is not sought out until these children have turned 18 in fear of these apprehensions. As an example, in my time as an intake coordinator, we received an email from a 10-year-old little girl. She lived in London, so we service the Niagara region, so she's a little bit outside of our area of help. She contacted us seeking support for herself because of her brother who has mental health concerns as well as an intellectual disability. She ended up leaving us with her mother's phone number and email for contact. So I grew up in London and I'm very familiar with the agencies in the area. And so I reached out to try to find her the supports that we could not provide her. And almost all of the responses I received back told me to call CAS on the family. They told me to open an investigation. They told me to just pass it off to them as it is their jurisdiction. And this was agencies that were built to support children. This exact reaction is the reason why young caregivers are unidentified and unsupported. With all of these in mind, we as professionals and community members must understand who young caregivers are. We must understand the reasons why families do not come forward independently, and we must know our roles and responsibilities when identifying and supporting young caregivers. Knowing how to identify them and knowing the right questions to ask, and especially knowing how important it is to identify early, so we can ensure that they are as connected to services and supports who acknowledge their family roles. So when we put this into our practice, it is important to ask questions. So when we have a family in our care with a member who's been given a diagnosis, it's important to ask, are there children in the home, how they were impacted, and the types of things they do. We also need to look for less obvious signs, like is there stress in the home with children? Are children coming up frequently in conversations? And is there an absence of family activities and recreational outings? And as always, we should be empathetic. Opening up is hard for many families, and we must make it clear of our intentions and who we are there to support, and not just solely for the individual with the diagnosis. As well as being knowledgeable and having a good awareness of support and resources that exist in your area, so you can offer it to families and are willing to provide referrals. In speaking of resources, I could talk about myself a little quick. So we are the Young Caregivers Association. We were established in 2003. We began from the Alzheimer's Association and kind of budded out of there due to the need of young caregivers in the home of parents with dementia. So since then, we've worked hard to transform the lives of the invisible population of young caregivers and young adults. And we're the first and only organization in Canada dedicated to support these young caregivers, their families, and bringing awareness across the nation. We try to give them the tools and support that they need to positively impact their lives. And then the biggest